So what is sex addiction if you don't know anything about it? And I think we need to start with what it isn't. So first of all, I'm a mental health clinician. I understand that there are certain mental health disorders where people will, because they have that disorder, they will also act out sexually. So for example, people who are in the midst of a manic episode, who are bipolar, they may be hypersexual or hyperspending or hyper anything, but when you get them stable and they're no longer in the active stage of their bipolar disorder, they're not hypersexual. They probably don't have a sex addiction. There are people who have OCD and ADD and other disorders that show symptoms of hypersexuality or even extremely impulsive or compulsive sexuality. But when those people are stabilized on medication with those disorders, they no longer act out sexually. So that means that they had a primary mental health disorder that included hypersexual behavior that ended when they dealt with their mental health disorder. But let's face it, can you be an alcoholic and also be depressed? Can you be bipolar and also have a gambling problem? Of course you can. So I have to both rule out and rule in these issues by what's going on in the present and by history. And then let's not forget that there are certain substances that people now pair with sex and they become hypersexual, like when they pair meth or coke with sex. And then it becomes chemsex, or what we call chemical dependency and sexual dependency joined. So all these things I have to be looking out for when someone comes into me and says, I think I'm a sex addict. One of the more important things for me to get across to you guys is that sex addiction is not fun. I know it sounds like it might be fun having a lot of sex, and believe me, I hope for you, having a lot of sex is really fun. You know, I hope that recreational sex or procreational sex or investigational sex or whatever kind of sex you're having is wonderful. But if you're a sex addict, sexual behavior that is not structured and thought out becomes like alcohol is for an alcoholic. When sex addicts engage in certain kind of sexual behavior, they often, when they're in certain emotional states, they will end up with people they don't want to be with. They'll end up engaging in behaviors that give them diseases or get them arrested. They'll end up doing things that might lose them their marriages or their family lives. So the simple idea that sex is fun doesn't mean that someone who's driven to be sexual and compulsive around sexuality is actually having any fun at all. In fact, mostly they're backpedaling and desperately trying to hold on to the things that they've got in their life before they all fall down like a house of cards. Sex addiction is not a guy thing or a gay thing. So I've been in the field for about 25 years. 70% of the people I treat are male, but 30% of the people I treat are female. And increasingly, as I go online to do treatment, I find more and more women who are willing to talk about problem sexual behavior online or in social media because it feels safer to them than going to a therapist's office or a support group. We see about 30% female sex addicts. And by the way, if you think about that and think about addictive disorders, I want to flip that for you. When I look at eating disorders programs, about 75% female, 20 to 25% male. When I look at sexual disorders programs, 75% male, 20 to 25% female. So in like terms, I can see how men and women act out their woundedness differently. It's not unusual. It would be more typical for a woman to act in with depression or eating or self-harm. It would be more typical for a man to act out with violence, rage, and sexual behavior. But that doesn't mean that women don't act out with sexual behavior and violence, and it doesn't mean that men don't act out with food. It's just more endemic to the species. It's how we work. So about 70% male, but I honestly think that number is changing with online porn and online interactions and the possibilities of hooking up in the way that you can. I'm seeing more women engage in behaviors that they describe as problematic. Without question, sexual addiction or sexual compulsivity is not a moral or religious issue. I don't consider you amoral or to have failings as a moral being because you act out sexually, because you've cheated, because you've hurt yourself or hurt someone else. I consider you have a problem that is emotional and psychiatric in nature or psychological in nature that has nothing to do with your morality. In fact, you probably have intact morality and religious beliefs, but they are masked by the much more powerful and much more compelling addiction, which makes everything else come second. These are important items, so I want to be clear about them. I'll be talking more about this in some of the videos that you're going to see or some that you already have seen when we talk about sexual health. But let me just quickly explain what a fetish is. A fetish is when there is an object that is not human object, it's an object like leather or panties or shoes, and you have incorporated them into your sexuality and they're part of your arousal. I guess the most human it can be would be maybe a foot. So people who have a foot fetish, they love sex when they can lick feet, kiss feet, play with feet, etc. People who are into leather, they want to be tied up or they want to tie someone else up, or this is a part of what turns them on. And fetishes can be, we'll talk more about it when we talk about sexual health. But just because someone comes into me and they say, I hate the fact that I'm into leather, or I hate the fact that I want to wear women's panties during sex, or I hate the fact that I like women's feet and I think it's disgusting and wrong. If something is not desired by you and you don't like it and it is part of your own sexuality, I may not join with you and say, oh, well, that must be an addiction. Because even though fetishism may not be desired and it may feel very driven and it may cause consequences, fetishes are pretty much fixed by age 11 or 12 and they're unchanging. You may be able to turn the volume up a little bit or volume down on a person's involvement with that fetish, but it's not going away. And if you're in the sex addiction business, you're in the behavior elimination business. And I don't want to tell people that I'm going to eliminate a behavior that I know can't be eliminated, like fetishes. And the way in sexual health that we treat fetishism is with acceptance and integration. In a similar way, people will say to me, oh, well, I hate that I am interested in men because I'm married to a woman and I have children and I love my wife and I love my kids, but I'm having sex with men and I'm looking at all this male porn. Never really have sex with women or look at female porn, but I just want to get rid of all that male attraction and all that male behavior because that's addiction. Well, I think I'm hearing, I would need to do more assessment, but my guess is I'm probably hearing somebody talk about the fact that they don't like their homosexuality, or they don't like their bisexuality, or they don't like orientation issues. Well, if you don't like your orientation, I can't help you because we can't fix that and we can't change that and we're well aware of it. So orientation, like fetishism, is something I have to teach people to accept, to incorporate, to bring into their lives because they're not going to change. And the third area that people will come to me and say, I don't like this part of my sexuality, can you get rid of it, is when they don't like their gender identity. So I've worked with men who want to be women and women who want to be men. And they hate that about themselves and they think it's wrong and they think it's bad and they want to get rid of it. And people will come in with things about their sexuality, orientation, gender identity, fetishism that really are fixed and unchanging by adult life. But they don't like them because it doesn't fit into their moral beliefs or it doesn't fit into their picture of who they want to be, and they want to get rid of it. And so they will come in to a sex addiction specialist, or they'll come in saying, I must have sex addiction because I'm interested in men, or because I like panties, or because I want to be a woman. Those things have nothing to do with sex addiction. Sex addiction or sexual compulsivity is not about what turns you on. It's not about who turns you on. That is part of who you are. Sex addiction is about how your sexual behavior affects your ability to function and how your involvement with sexuality is affecting your life as a whole. And if it's happening in a way that is addictive, then we need to look at that and try to fix it. The last piece, and this is particularly important for me to say to you, is that sexual compulsivity and sexual addiction is not sexual offending. So somewhere around 92% of sex addicts or sexual compulsives never cross the line into sexual offending. In order to talk about that, I have to explain sexual offending. Because in America, where I live, sexual offending actually varies from state to state. It's a legal issue. So what is considered to be sexual offending in Arkansas may not be sexual offending in California. And if you look at it internationally, what is sexual offending in Thailand may be very different than what sexual offending is in Japan. So how do we as therapists, as clinicians, look at sexual offending? And I'm going to give you a very simple definition. Sexual offending is simply this. Sexual offending is non-consensual sexual behavior. That's all it is. It's non-consensual sex. So I'm going to give you a really good example. If you and I are, and you're just going to have to be my date for a minute, if you and I are having a great dating experience, I don't care if you're a man or a woman, whoever you are at the other end of that screen right now, and we're just having a great time, we love each other, we think we're the best thing since sliced bread, and we've been dating for a year or so, and you tell me that you have this secret, that you really wish that me, your lover, your friend, your partner, whatever I am, you wish that I would come over one morning while you're getting dressed for work and look in the window, and you're going to look out the window and you're going to kind of wave at me, and I'm going to wave at you, and I'm going to watch you getting dressed, and then I'm going to come in the house and we're going to make love, and then we're going to have coffee and breakfast, and we're both going to go to work and have a great day. So if you ask that of me, if tomorrow morning when you look out your window when you're showering and getting dressed, you see me looking in the window, smiling and looking excited, are you being offended? Absolutely not, because you have given me consent to stand there and look in your window. However, if you look out your window tomorrow morning and you see a strange man that you don't know looking you up and down in your window while you're showering and dressing, you're being offended because you did not give consent. And that is the easiest way to understand offending in any culture. If someone is too drunk to consent, if they're not old enough to consent, if the law does not allow them to consent, if they're too mentally ill to consent, if they're unconscious, the lack of consent means offending. So 92% of sex addicts are not engaged in sexual offending behavior because they're engaged in consensual sex. My clients are seeing prostitutes, they're having affairs, they're looking at porn, they're doing things that may be, for them, screwing up their lives, but they're not necessarily going to be arrestable behaviors. And there is a portion of the offender population that does have very addictive and compulsive behaviors. We see that a lot in exhibitionism, we see a lot in voyeurism, we see it in various forms of sexual behavior. However, the majority of people who are coming in for sex addiction do not have an offender history. Unfortunately and sadly, a place that some sex addicts have found themselves going is into underage porn when they're online. And that has become a serious problem for them and a lot of people in America.